Good morning, good afternoon, good evening, wherever you are. Welcome to this online meeting. If you wondered what you joined, we are going to have a conversation with one another and a briefing on how the challenges and road to change around the HIV and reproductive health issues and insights from 2025 to 2026. If you are here because you have an interest in this, and we're thankful and welcome you to this. Thank you for joining us. As we know, we've all gone through a time period in the past years where the faith-based organizations faced a number of challenges, from funding uncertainties to policy shifts to humanitarian crises. Our world is in turmoil. But this also has offered us some amazing opportunities to reflect again and look at new partnerships and start to do new innovations. Any crisis also offers amazing opportunities towards transformation and action. And the focus of our conversation today is to look back a bit on the past year, on what we've seen during this past time, and then to also look at what's coming in this year and the opportunities that arise, and to reflect together on what might be the areas of collaboration that we can do. So I invite you to listen to what is going to be shared with you, but keep your questions ready and all your conversations and contributions, because towards the end, we will then have ample time, hopefully, to also hear from you on what we need to do. I want to start us off with a reminder and a prayer from Ephesians 3, where Paul prayed, and I think it's very relative for us in this time, where Paul prayed and said, I pray that out of his glorious riches, he may strengthen you with power through his Spirit in your inner being, so that Christ may dwell in your hearts through faith. And I pray that you, being rooted and established in love, may have power, together with all the Lord's holy people, to grasp how wide and long and high and deep is the love of Christ, and to know this love that surpasses knowledge, that you may be filled to the measure of all the fullness of God. Now to him who is able to do immeasurably more than all we ask or imagine, according to his power that is at work within us, to him be the glory in the church and in Christ Jesus through all generations, also today, forever and ever. Let's pray. Almighty God, our help and refuge, who knows that we can do nothing right without your guidance and help. We pray that you direct us by your wisdom and power, and that we may accomplish this task and whatever we do according to your divine will, so that it may be beneficial to us and the others, to the glory of your holy name. Amen. Now, I didn't introduce myself yet. I am Reverend Christo Greyling. I'm South African, as you could hear. I am living in the Netherlands. I am the part of the Church's Commission on Health and Health and Healing, and I'm the chair for the working group on HIV Reproductive Health and Pandemics. Now, today we will be joined by a number of people that help us to contribute. The first part, on the reflection part, we will listen to Manoj Kurian of the Health Commission of the World Council of Churches, joined by Gracia, Violeta, who's the program executive for HIV Reproductive Health and Pandemics. And then the partners that will help to reflect back on last year is Reverend Jane Ganga. She is part of the Ecumenical Pharmaceutical Network. And we've got the privilege to also listen to two young people, Allan Nyamari and Jonah, Ojjala, who are part of WCC's HIV and Faith Youth Academy. So let's start immediately with that. And move over to the previous year and reflect on that. And to do that, I'm going to ask Manoj if you want to add anything to your introduction, and any of the others do so. Let's start off with you, Manoj.
Thank you, Christo. I will we'll go directly to the presentation. Can we put up the PowerPoint, maybe? Yes. Let's take a look. I mean, I will just look into the next slide. Let's take a look at the yes. Take a look at the 2025, the United States federal funding freeze. So, I mean, just to begin, for us to understand the in January of last year, the U.S. administration ordered a broad pause and review of nearly all U.S. Foreign aid, immediately affecting billions in humanitarian and development funding managed through UN, through the USAID, but also USAID, the arm of the United States government, but also through UN agencies and NGOs. So what we have to understand, the impact has been so severe because already around US supplied about 45% of all global health funding when you look at the period from 2019 to 2022. So suddenly this reduction was it was a reduction of about 45%. So they're already giving 45%, but this sudden reduction was very dramatic. So the development assistance for health is estimated to have dropped by around 21%. So globally. So this was because there was a 67% decline in US financing, over which amounts to around $9 billion. And but the decline was also contributed by a decline in funding from other countries as well. And so there's a lot of, so as you see, the challenge has been not only for medication, but also because of disruption in the personnel, loss of trained personnel. Their salaries were cut. Then you had closure of grants. There were not only HIV, but also gender-related issues about human rights-based work. So there has been a lot of disruption, and additionally cuts and uncertainty about the National Institute of Health, which is a very big U.S. institute, government's funded institute, and other U.S. research funders also were reduced. So the research and development and helping in monitoring of pandemics, etc., was reduced by hundreds of millions of dollars. So there's been sharp reductions in HIV, malaria, pandemics, and emerging infections. Next slide, please. So what are the implications on the faith-based organizations? The implications is because FBOs are part of the wider government and the national support systems, and it was not that they are actually taking a big chunk, 40 to 60% of healthcare delivery, and many of their institutions are in very remote areas. So the sudden consequences, the cuts have been impacted through the salaries, through drug delivery, drug distribution, and also support for communities on the ground. So that was this has been accentuated by reductions from other countries as well. From the other global North supporters, especially because of declining investments into development and health, and redirecting it to defense issues and towards trade. Next slide, please. So now we go into the UN reforms. The UN. The UNAT, the initiative, which is launched by the United Nations 80th anniversary, is a reform umbrella meant to review and refresh multilateralism. and the UN development and humanitarian system amidst definite and undeniable financial pressures. Now, the WHO has been impacted hugely, and so they are also reforming. And of course, there is the UNAIDS is also in the way of being wound down and being, it's called the sunset. That means by 2027 it will be closed. And other UN structures like UN Women is being now emerged into the UNDP, that's a development fund. So there are huge challenges. But when you look at the implications, there has been, it's also an opportunity, as Reverend Christo said, opportunity for restructuring and reducing the over dependence on external funding. So this is quite critical. It's an opportunity. Though the sudden reduction has actually disrupted, it has pushed countries to take on more local funds, localization of support, and the pressure has also hugely been placed on faith communities because they have had to also to raise funds from other sources. But let us be clear, this has not happened. I mean, these funds that have disappeared have not been filled by anybody else. So there is a lot of realigning and remobilization. And the UN reform process is going on. It's very serious. It is hoped that the outcomes will be good, but in the interim period, it is very difficult. Thank you.
Thank you very much, Manoj. Now, an important date in the agenda was the ICASA AIDS conference in Africa. And Jane from Kenya played an immense role in that. So Jane, share with us what happened there.
Thank you so much, Christo. And indeed, despite the challenges that are facing all of us, including the faith communities, we continued to engage in different platforms. And one of the key ones was the ICASA 2025, which was held in Accra in Ghana in December 3rd to 8th. And the theme of the conference was Africa in Action, Integrated Sustainable Responses to End AIDS, TB, and Malaria. And I'm glad that it took also the version of sustainability, looking at how communities and responses can continue sustaining themselves in such unprecedented times. So the faith sector engaged in 8 strategic sessions. And within these sessions, we were able to engage different stakeholders, ranging from parliamentarians to young people, the civil society, and also other health partners who are in the space. And we continue to affirm ourselves, even as a faith community, as actors who can be trusted, actors who have the moral authority, who have the reach, and who have the power also to drive the HIV and health agenda. We focused on 4 priorities. We focused on eliminating stigma and discrimination, and this has been one of the key contributions that the faith communities have brought to the fore. Focused on strengthening treatment and adherence. Again, faith communities usually serve over 40% of the health provision in different contexts, and therefore having faith-based hospitals again becomes a very strong point of engagement that we are bringing. We focused on integrating mental health into HIV programs. Again, the challenge of mental health is an emerging one, and faith communities have again stepped up to ensure that that integration is happening. And also, more importantly, is also advocating for sustainable financing. And specifically, the faith community has been involved in advocating for the Global Fund replenishment. And of course, we're part of the past replenishment, but have been very vocal in the 8th replenishment. Next. So the key highlights that from ICASA that we took away, and maybe this will also inform our engagement this year and maybe in the coming years, We need stronger faith parliamentarian partnerships for equitable access to HIV innovations. So before even the ICASA conference, we had a number of dialogue meetings with the parliamentarians, but we feel that this is an opportunity for us to really showcase our work and raise our advocacy voice as we engage parliamentarians going forward. Number two, a key highlight that we took away from the conference is the need, for clear priority, ending stigma and creating judgment-free faith spaces, because that's where we thrive. And most of especially the African, countries, or you will find over 80% of the citizens ascribe to a certain faith. So this is a very, key opportunity we have to end stigma and to create spaces that are stigma-free, judgmental-free, and we are able to continue touching lives in a big way. Then the third one, which was a key takeaway, is the need to continue engaging in mental health integration. As I said, we have the facilities, we have the many other platforms to engage in this issue. And one of the statistics that was coming out was the fact that 40% of the suicide risk kicks in 3 months after diagnosis, and there is a lot we can do within that period of time, and therefore we have the opportunity to bring change. And finally, and not the least but also very important, is to focus on advocacy, and especially when it comes to health financing issues, domestic financing, and specifically our voice to continue being heard in closing the gap of 6.6 billion towards the global fund. So it's a real call for us to continue engaging in advocacy on health financing, but also on other matters that are quite important to the health and well-being of our people. So thank you so much, Christo.
Thank you so much, Jane, and thanks also for your leadership in helping to bring this about. Now we're going to ask Allan and Jonah to share with us. They will speak without cameras because of internet connection and some technical issues on that side. And so over to you. Help us list. You were quite involved in the Global Fund 8 replenishment process and being the faith voices there as young people as well. Would you share with us?
Good afternoon, everyone. This is Allan joining from Nairobi. Sorry again for the camera. So yeah, I would like to first of all acknowledge the difficult year that was 2025. Had a lot of significant funding changes and funding cuts, which had a lot of effects on young people living with HIV. So last year was when the AIDS replenishment was being launched in February 2025 for GC8. And the launch was hosted virtually by South Africa, where Christo is from, and the United Kingdom. Next slide. So for the Global Fund, for all the countries that required investment for the Global Fund to, combat AIDS, TB, and malaria, there was a target of 18 billion. And that target, if it were to be reached, would have saved the lives that were, that were proposed by the countries that had given up the allocations. So among the things that would have been achieved by the $18 billion was free healthcare services. Free healthcare services for other health priorities would advance the progress towards the elimination goals of 2030. Countries would have been more prepared to pandemics. A lot of health and community systems would have been strengthened, and innovations such as the one we're experiencing right now, like the new long-acting injectable prevention options, and scale up of the same innovations to countries, to third world countries, to countries that need them most. That's what the 18 billion USD would have helped. And then the inequity gaps, for example, in gaps in HRH, gaps in service delivery, gaps in advocacy. All those gaps would be reduced if we would have achieved the target of 18 billion. And of course, health is not just one of biomedical problem. It's also a structural problem in terms of, people living less than $1 a day are just one disease away from poverty. So if that pledge of 18 billion would have been reached, then we would uh, we would reduce poverty a huge deal. Next slide, please. Mm.
Thank you.
So
I think
why is
Allan
it?
is going to take over here, right?
Yeah, Jonah. It's Allan. It's Allan still. Jonah. Hello.
Yes, we can hear you fine.
Okay. Okay. Sorry, I think I took over Jonah's slide. That's my bad. But yeah, you can still hear me.
Yeah, we can.
Okay. Okay. So last year we were involved with last year's young people. As a young person, I was involved with a lot of the World Council of Churches activities, and I personally testify that it really helped me a lot with advocacy and activism in this space. Giving me the tools to, like have my government more accountable and more responsible to respond to the needs of the citizens. And this is because that is their responsibility. I mean, that's why they are elected. One, as a leader, even in the Bible, they have a moral responsibility to care for the vulnerable, because caring for the people they have been chosen to represent is taking care of God's creation. It is a divine mandate to do that, to sustain life, to sustain hope, to sustain dreams, to sustain better futures for all. And the most basic way they can do that is for policies like, for example, a policy that is very integral in fulfilling this mandate is the right to health. And for that to be reached, there has to be strong investment in local health financing. There has to be strong investment in programs like the Global Fund. And we can say this here, but we did an amazing campaign back in December where we were calling for governments to at least, reduce the deficit of the pledges they want, which the Global Fund had a target of 18 billion, as I mentioned earlier, and they were only able to reach around 11.34 billion US dollars. So they're short by 5.46, if my math is accurate. And so that looks really like a small gap, but it's huge. That's a huge gap. So it's really hard to tell someone what to pick and what not to pick. So to cover this, we had to, go online. The best way young people can is ever take the campaign online, take the campaign to their doorsteps, involve all the right people in the government. And so that's why we launched the campaign earlier. And so we also were creating awareness on what the Global Fund is. And that's where people were now learning what is the Global Fund. And the Global Fund is a partnership that responds to the needs of countries. And the Global Fund is the best model of what a multilateral partnership can do for the most vulnerable. So it is very transparent, because I can testify that the Global Fund involves communities. They talk directly to communities. So as a person living with HIV, as a person who is affected, for example, by TB, they actually give their lived experiences in the decision making. So, and it's also important to note that many of the political leaders we have in our respective countries are people of faith, either Christian, Muslim. They are people of faith, and they should understand, and they do understand, that bringing health and healing to our communities, to us, is a continuation of the healing ministry that was instituted by God. And yeah, that's why as a member of the WCC HIV Faith and Youth Academy, we were supporting the replenishment of the GC8 of Global Fund Cycle 8. Next slide. Yeah. So this is exactly what I was saying earlier, that the Global Fund is replenishment was only able to achieve 11.34 billion As you can see, yeah, I was off by a few figures here. They were shown by $5.36 billion. So that means a lot of programs were cut off. Programs that were being reprioritized, maybe they were being termed as non-essential. But most of these programs complemented most of the biomedical interventions, as much as it's being said that it's not as important. They are very important programs like support groups, programs like home visit. Most of these programs are being cut. And these programs that are really tying close to the community are very important, because you cannot take medicine and you don't understand why. You need someone to hold your hand. And all of these programs, just to mention a few. And so the implications are, for example, a lot of allocations have been cut. And now most of the countries, for example, here, we are now looking forward to integration now, where we're going to have most of these services integrated into the service delivery models that are currently in the country. And so now those conversations are what are going on. It's messy, it's rushed, but it's pragmatic. It's not perfect, but it's what's happening. But we could still go on with G8 if the $5.36 billion was achieved. And the call to action is countries like France and Japan, I believe, haven't realized the pledges yet, and they are still being expected. So now there are really calls on local health financing. That's a huge mention on domestic resource mobilization. We call to our ministers of health, ministers of treasury, the leaders in our countries to finance the health system's response. So, and to transition to, funding ourselves. It's really hard as a country to swallow a pill and say that we have been depending on heavy donor funding. And it was really discomforting to know that in case that donor was to pull out, we were in limbo. And we saw that last year, February, when the US government had pulled out a lot of the funding, which affected maybe, for example, CDC, donor-funded clinics, and also a huge portion of global funding was for the US. And after a lot of political landscape change, now EU countries now restructured their funding to the health systems of the other countries. So now countries have to transition into funding themselves. So the call to action is for everyone. Especially, we really focused on this in our campaign. It's for every country, every person, every young person, every leader of faith to go and hold these leaders accountable to finance their health response system. And I think that's our bit. That's what we covered last year.
Thank you, Allan. Good job. Jonah, we didn't hear your voice yet. As a young person who was involved with this process, and how are you reflecting on what happened and the future around this?
Oh, thank you so much, Christo. I think I'll be very, very brief, since most of the things have been stated by my colleague, Allan. But to note, during it was a wonderful experience for young people to be involved in this advocacy, to definitely hold our national governments accountable and to remind them that actually health must be funded, and we must take it must take priority before we wait for donation from outside. It's not that we are dealing with donations, but even us as the nationals, we are supposed to take care of our own people before other people do that. So I think it was a great experience and a very wonderful experience. I enjoyed having young people and working with young people and sharing and echoing their voices to the governments and the legislators to prioritize health funding, and just as my colleague has shared. So I think I will come back more in the next steps. I think definitely that's why I will have a lot to say. Thank you very much.
Thank you, Jonah. Gracia, I'm passing to you to talk about the international conference on family planning, but then also to look at this year and what's coming.
Yes. Thank you so much. So, we work in reproductive health and HIV. We used to have one person doing the reproductive work, but she took another job, and the church that was seconding her could not still support another person. So now I am having to do this work as well. And so this is one of the first activities integrating reproductive health in our ongoing HIV work. Is very important, I have to say, and our portfolio on the World Council of Churches on reproductive health is not very big because we had long experience in HIV, and also the projects that we got are for HIV. I will tell you after, in the second presentation, how we are planning to integrate reproductive health in HIV. But my former colleague, she got herself involved in this conference. It's a big conference. They do it every 3 or every 2 years, I'm not very sure. It's the International Conference on Family Planning, and it brings a lot of stakeholders to discuss family planning, reproductive health, sexual health, HIV sometimes also. So I attended this, and we had a lot of sessions. We were part of the Faith Committee. We were one of the co-chairs of this Faith Committee. This is a space that she managed to leverage for us. And because it was in Bogota, it was very easy to relate with the local organizers and participate in sessions that engage the media. Like, for example, this one, which is like a live stage they did. The conference called for abstracts, and I presented one on my experience living with HIV and discovering my test when I was the daughter of an evangelical pastor 26 years ago, and telling this story, how the church reacted, and also how the church reacted when there was a pregnancy of another pastor's daughter. This got a lot of attention, and this number of views that it got, I didn't put them here, but because it is online and it's not our own platforms, it's platforms of someone else, they are getting a lot of visibility and expanding our impact. This is very important. I think we have to do more activities like this, which is engaging in things that are organized by other partners, even if they are secular, because we need to bring this message outside of the faith communities, with the faith communities, but not only with them. So we are going to try to do more than this. And with this committee of the International Conference on Family Planning, we are designing strategies to keep engaging, particularly with the young people. For example, in this conference that is coming from the African Christian Health Association, we are going to meet the young people who attended this conference. And so we are going to do in every opportunity that we have, keep these relationships strong. There is a big amount of partners, governments, foundations, young people, associations of women working on reproductive health. And I think we have to just increase this work. So in summary, this is what I can tell you. There is a whole report about these faith activities, but it's not only our report, because we were part of this faith committee. If you want to know everything that happened during the International Conference on Family Planning, I can share this report with you, which is a joint report by the 4 co-chairs and all the faith committee members that were about 60 partners. And this is what I can tell you about this, Christo. Maybe we can go to the questions.
Yeah, is there any questions around the comments about the 2025 part at this stage before we move towards 2026? If not, I think you can type your questions along in the chat box, and then we can handle some of them later as we go on. Perhaps you can help us with a second presentation as well. Here you go. Gracia, lead us on.
Well, now I really didn't want to be speaking all the time, but nobody else has this information except Manoj and Christo. So I will have to do this alone. I hope you can still listen. So these are key activities that will happen in 2026. It's not everything that will happen, and something may happen that we don't know yet. So I will give you this brief idea of what is planned for this year. We can go to the next one, please. So we are going to engage in key global platforms. The first one is ACHAP. ACHAP means African Christian Health Association Platform. They have a biennial conference. They are going to meet very soon, next week. And the theme they chosen is very important, rethinking health systems for Africa's future. We are going to engage disseminating our HIV theological manuals. We have 4 new HIV theological manuals, and also a mental health course, which we will launch in October. Manoj is leading this work. If you want to understand better how this mental health course will happen, because it will engage churches, it will be online, but it will also be in presence in churches at country level. You can ask him, he's on the call. Then we also have a second International Congress on Human Mobility. This is for Latin America, and they chose the theme of faith, dignity, and justice in movement. This is led by UCEL, the University of the Methodist Church, and they will gather many partners from Latin America, and they will discuss the role of the church in responding to migrants. We are going to speak about health and migration as a topic, which is something we didn't do in the past, maybe slightly, and we want to do more because this is a very important area. And as you can see in the news, migration became a very hot topic in the last months. We have then the 26th International AIDS Conference. They have this theme, Rethink, Rebuild, Rise. And we proposed an interfaith networking zone. We are waiting for the organizers to tell us if they accepted this or not. Also a workshop on budget advocacy, which is something that we want to equip the religious leaders, how to advocate for budget in your country alongside the communities living with HIV. This conference is the largest HIV platform. It's a great space for us to influence and also share our wisdom, our tools, not just the ones of WCC, but the ones of all the ecumenical partners. Normally in these conferences, we also used to have an interfaith pre-conference, but we never did this alone. We always did with a committee, and particularly with UNAIDS. Now we could not propose an interfaith pre-conference because it's very expensive. And this International AIDS Conference will happen in Rio de Janeiro, Brazil. And it is very difficult. I mean, it's expensive. So we have not been able to mobilize support for having an interfaith pre-conference. We might get, but we so far don't have this. This is going to happen in July. Next one, please. So this year we are going to have activities in Nigeria, India, and Philippines. We are going to mobilize religious leaders and communities to put HIV back as a priority in the health and development agendas. You have seen how HIV is almost being erased from the public discourse, and because many people don't know what are the challenges, so we are trying to put it back, but not just as a topic, but with budgets that don't depend in the international cooperation, but are part of the government investment. In India, additionally, we are going to further disseminate these HIV theological manuals. They are 4, and they speak about HIV and migration, HIV prevention, HIV among young people, and HIV and mental health. This is part of projects that we have, so we know we will do this. Next slide, please. We are praying for being able to support one activity in the Democratic Republic of Congo. This is alongside the Uniting Churches of Sweden and Week of Compassion, an ecumenical partner based in the US. They are going to support a hospital owned by churches in DRC they are doing testing and treatment for HIV, and they want us to accompany this work with advocacy and educational activities for communities and religious leaders. We do not have funding for this, but we are trying to locate some money to support. You know, there are many challenges in DRC, Democratic Republic of Congo, so it's a priority. Also in West Papua, we happened to learn last year, our colleagues were there for other activities, and they told us that The levels of HIV are very high. They even were able to perform some testing during the ecumenical activity, and the number of positive cases was very high. So West Papua is also a priority. There are NGOs, faith-based NGOs, that are doing work, and we want to support them. But we have not yet defined how this will be, and we are not very sure about the budget. We also ask you to pray for us for this. Next, please. So we don't know what ways there will be to engage on this, because these are spaces that don't depend on us, but we know they will happen. For example, the Global AIDS strategy will be approved in a high-level UN General Assembly, which is likely to happen in New York or in September, in June and September. And normally this work is led by UNAIDS, but since UNAIDS is in a phase of transition, we are not sure who among the UN partners will lead this work. The Global AIDS strategy already exists, but it has to be approved by the UN General Assembly. And it's in this meeting that they will approve this, and they will also make a commitment for what the world will do on HIV for the next. Maybe they will do the commitment for 10 years, then they have a revision after 4 years. This is what they did last time, but now, because of how the situation is, I don't know how this political declaration will happen. Actually, one of the things that we have scheduled for the next month is to meet UNAIDS staff, the ones that are still in Geneva, and ask them what are their plans for this work, how is it going to happen? So we are going to keep track on this and let you know what ways, what mechanisms of engagement are there for any people, but also for faith communities. About the Global AIDS strategy, we can simply make a summary like we did with the last strategy and present it to the faith communities, suggesting activities that we can do as faith communities to support this strategy. However, I think this document is still needs the approval of the UN before we can say something publicly. So we are going to come back with more of this when we have the information. Next one. So what key messages we identify are necessary in this year? First, putting HIV back on the development and health agendas. We are realizing how HIV is being erased from the discussions and then from the budgets. And this is leaving more than 40 people living with HIV in the, in the uncertainty of thinking what will happen to my medication. But also this is ignoring the 1.3 million people who got HIV last year. Many of them are young people. That's why we think it's very important to put HIV back in this place of urgency. Many politicians are not seeing this as a need, and we think the role of religious leaders is key to help us bringing this to the center. But also to discuss sustainable responses. We know the situation of HIV is not the same as 40 years ago when the epidemic started, but we need something that is sustainable and that does not depend on the international cooperation, because this international cooperation, we know it will be reducing little by little. Some of it will disappear, but some of it will completely will reduce completely until it disappears. So we think it's very important to connect these discussions of sustainability with the faith-based health networks, which are in the countries, and they are very strong, and they are not depending on this funding. They are there, and they are already doing a lot of work. So we have to bring these topics, and we might write some tools to have these topics more explained in short versions that you can share on your phone, easy to download, and these kind of materials. This is on our plans for this year. Can you go to the next one, please? So other key messages for this year include this equitable access to HIV innovation, and not just HIV. We have innovations also in reproductive health, but any innovation, if it doesn't have an element of equity and justice, it can become another layer of inequity. So it becomes something that you can get if you can pay for it. And we are saying that we need equitable and fair access to these innovations. Particularly in HIV, we have long-acting injectables that they can simplify the life of people living with HIV a great deal, particularly for the ones who cannot take the medication anymore, because you can get an injection every 6 months or once a year, and your treatment is completed. We are not saying that we need to move everyone take this. No, we are saying the ones who really need it. Also, we want to continue stressing this message that health is a human right. Human right is a fundamental human right, and is the right that enables the other rights. And this means that if it's a right, it has to be protected by our governments. Can you go to the next one? And this idea that we have tried to present from not only last year, but even before, a joint leadership of communities and religious leaders. We have seen the religious leaders very strong in the beginning of the epidemic. At some point, we became complacent, like many, because we thought HIV is something solved. And I think now we really need the voices of the religious leaders, because they are very influential with the politicians, but alongside the communities. Let's not do this alone. Let's do this together. And also involving the governments as much as possible, because they have the responsibility to do this work. Very important to strengthen self-care approaches that are based on faith. Self-care is a methodology developed by the World Health Organization, and it's a methodology that is saying that we should give back the trust to the community and to the person, but it doesn't mean taking away the responsibility of the duty bearers, the government, the public health system. So this works when we recognize the human rights, the dignity of people, and the decision they can have in their health. So we think we can have a great space to work how this self-care approach can happen in HIV and reproductive health, but based on the faith. And this also involves the church, because self-care doesn't mean that I will do it alone. It means that I will be accompanied by my church community, but I will have autonomy in my decisions that concern my health. Next one. So another idea is to have this joint advocacy for sustainable people-centered health responses. Well, we are already doing this. We want to strengthen doing this together and for sustainable responses, because dependence is not going to benefit anyone. And religious leaders and communities, this is the alliance that we see is a must, and also discussing with the policymakers, because they have the knowledge and the power at country level. Next one. So we are also saying that we must advocate for the expansion of equitable access to HIV and reproductive health services, because these services are there, they are in the countries, but we know there are problems of inequity, especially for women, girls, young people, marginalized groups. This includes migrants. This includes people who are refugees, people who are on the move, and people from marginalized groups on HIV. This includes also young people, particularly when the country has an approach of making somehow health something private. It's very difficult. So we know religious leaders can help in putting this demand of equitable access to whatever services are already available. We have one more. And strengthening the health system using the faith-based networks. There is, the idea is not to create something new that will need funding from the Global Fund or whatever actor. The idea is to strengthen what is in the country, the health system, the community system, which is the faith-based network, but also whatever the people living with HIV are doing, and integrate them into what is there already. This is happening. I don't think we have taken note of this work, and we have not taken note of how the faith communities are already doing that. So part of our work should be maybe documenting the best practices on doing this, and then sharing this knowledge with other faith communities around the world. Next one. And of course, going back to the theological principles that support our work, human dignity, rights, and pastoral support, we are not doing this just like any NGO working on these topics, but because we believe this is the right thing to do, because we believe in the theology of love, the justice, the equity, and the dignity of every human person. And bringing these elements to HIV and reproductive health work is very important, because these two areas are very vulnerable to be stigmatized, as you well know. We go to the next one. So apart from that, we continue engaged in global health with global health partners. We had a very strong relationship with UNAIDS, and then that is still there. We are still attending the meetings of UNAIDS. I don't know for how long. We are also in relationships with WHO, and WHO has very different departments. So it's we cannot say we have strong relationships with each one of them, but with some of them, the ones working on reproductive health, the ones working on cervical cancer. We also have some connections with the ones working on mental health and the cancer and other diseases. And we are trying to connect with the ones who are doing migrant health. So there is much to do in WHO, because I think WHO is going to take most of the roles of UNAIDS. So we are engaging with them as part of their guideline development group, in particularly cervical cancer and sexual violence, intimate partner violence. But we need to develop more relationships with WHO, with UNDP, UNHCR, and any other agents that are working on health. So this is paying attention to what is happening in the context, and to see what actors are having the opportunity to say something and to engage. Particularly in this moment, the Global Fund is a very important actor for us to engage, but it's not the only actor. So we are just keeping our eyes open to see what is going to happen in the world and who we need to engage if whatever situation comes. For example, if there is a pandemic, we know something else will happen, and we know who to relate, for example, in WHO and other partners that are working on pandemics. This is the last slide. Yeah, so we can now go to questions.
Okay. Thank you very much, Gracia. You are allowed to have a drink. You did very well. Now, I want to open the floor to you. All of you that's on the call know the situation very well. You've been in this work. For me, some of you that I recognize on the call has been in this work area for many, many years. I want to hear from you how you feel, because what I hear from the feedback here is that we are in a way on a crossroads of moving into a new way of working. We are at risk to say the same things to repeat ourselves over the years. And what WCC has done an amazing work through the Ecumenical Advocacy Alliance and all the years of focus on HIV, one of the few organizations who maintained a strong singular focus on HIV. But what I hear now is the need to have a bit more of an integrated focus on our messaging and our collaboration that integrates migration focuses, mental health, reproductive health issues, and to really bring this together. My question to you is that the approach we should be taking? How do we take this to policymakers in a strong lobbying way? But more importantly, how do we raise this as an issue again that the church come alongside us on? We know reproductive health is a difficult issue where we want to maintain who we are as faith communities or what we stand for, but at the same time continue to stress the health as a human rights and access as a human rights in all these difficult situations like migration and war situations. How do we raise the voice of the church again to stand alongside us on this? is it true? Is it true that the church, in a way, has become less of a voice of this, and that we need to invigorate the church not only in Africa and Asia, but also in other areas where there are more funding available to come and speak up about the needs, continuing needs of HIV, but also as it integrates with TB, malaria, but then also specifically with reproductive health. What's your thoughts? I would love to hear from you. Please, anyone, unmute, put your questions in the chat. I would love to hear what you think. If you raise your hands, that will be helpful. Violeta, if you can help us if we see any hands. Manoj, I'm going to put you on the spot while we wait for some people to respond on this. What's your reflection on this as you listen to all of this?
Yes, I mean, I agree with you, Christo, that I think what is very important is that we are able to look at things, all these issues holistically. And, the HIV work has been very strong. And we have such dedicated, people, communities bound together for action. And we need to galvanize this movement to connect up. So it's almost like it's a bus that is running, and then there seem to be less fuel and less people, but it's a bus that is running, and we need to put in people, bring in the mental health areas, issues of reproductive health. So it's because we are serving the community. The community does not work in silos. So we have a movement, and let this movement serve the wider community. Thank you.
Okay, thank you very much. There's a question in the chat from Zeal that says, what are the plans of WCC in reaching the members of the community who are victims of these health challenges? Are there subcommittees in WCC tasked with making sure every faith community is in the know of these health challenges? And I think, Manoj, if you can quickly answer that one for us, and then we'll go back to Samuel and Jane.
I mean, it is there is always, the church has two aspects. One is the prophetic voice of the church, and Jesus was very clear. I mean, he gave importance to the community, to the small voices, and he himself gave up his life and was crucified. So in reality, according to the teachings, even the smallest and the marginalized can relate with the founder or of our teacher and Lord. But in practice, many times, we get compromised. So this is an ongoing challenge, and that's why you are here, and that's why we are working. So that is the reason for our existence, to face the challenges you said. So it's an ongoing challenge, and in every movement and you saw the slide in Gracia's presentation to bring coherence to the leadership and community, to bring together. So as you are asking, you need to also test everything that we do and challenge, and we continue to respond. Thank you.
Thank you very much. Samuel, first you, and then Jane, and I see Zeal has got his hand. I'll come back to you, Zeal. So Samuel first.
Thank you so much. Good afternoon to everyone. My name is Samuel. I'm a young person living with HIV. And I also wanted just to speak through, I heard my colleagues speaking around how the the replenishment advocacy that we did online that really sort of unpacked a lot of conversation. And just to share a snapshot before I can also just contribute to the question that has been asked, is that within the global digital space that we engage in terms of speaking around the issues of global fund replenishment, one of the conversation that came out is that we had a discussion with one of the members of parliament who is the co-chair for the Sexual Reproductive Health Caucus, where you even shared an opportunity of invitation, which at the country level, there is a youth-led meeting that is being planned. And around the discussion is that Voice is one of the supporters that want to support this meeting to support youth-led and young people in our country. So it was shared within the caucus chair of the member of parliament. But also one of the issues that also came out with my advocacy, one of the Christian-based organization noticed my work, and they clearly invited me because they normally host children's camp, and they talk about different issues. So one of the core issues that they want me to sort of help them in terms of delivering the mentorship session within this camp is that just to provide a lived perspective forum and mentorship within these young people, and also just share more around how my journey has really been and other programs that would help in terms of issuing out issues of disclosure and acceptance, because they notice this has been one of the gaps in their conversation during this camp. But also just to appreciate some of the presentation that has really been given all along and where we are in terms of this question, how integration really looks like in terms of moving forward for the year. For me, I would say particularly in the agenda of young people, I think integration has really been already playing a role in terms of much of our work, because we are almost everywhere. And when it comes to providing the needs, the PRA tailored services or conversation with our fellow peers, you would find that we'll cut across, we talk about all these issues. And one of the constant issues that is really affecting in our country, we've seen so much suicide that are happening. And that gives us a caution that there isn't much that is being done around the mental health perspective. And this integration now becomes more effective in terms of helping us as young people, reaching out to our fellow young people in the universities, in as much as we preach hope. I think hope should be a demonstrative act, in a sense that we should be able to identify what particular need that these young people, these individuals are really sort of being affected with. And one example I can give in my church is that one particular thing that I love, when my pastor is preaching the message, he would echo in a reality firm, relating the message with the word of God, but also picking out a reality point of view on how these things are really affecting us people. So it gives a picture in as much as we come through, we gather. But there is also another way that we really need to sort of speak around to these cross-cutting issues, sexual reproductive health, HIV, and holistic in how we can engage with different policymakers. For me, this is a welcoming move, and I feel I'm really excited already seeing how this 2026 would look like in terms of some of these engagement. And maybe my plea is that the presentation of how the activities outline would look like, are we able to be shared with? It could be a tentative plan just for us to sort of follow through and see how best do we tailor some of our messages as we continue pushing up on different social media platforms to enable that there is those meaningful engagement. Thank you so much.
Thank you, Samuel. Thank you for your contribution. Jane.
Thank you so much, Christo. And indeed, there are many shifts that are happening. And I think it also now calls for us, the big communities, to really look at the way we do business and shift accordingly. And I'm thinking one of the things that we need maybe to constantly consolidate is our value proposition as faith communities, and really reflect on it and see how best we can have the shift, even as the world shifts. And one of the things maybe I would recommend is for us as faith communities, shifting from being just implementers to strategic partners. Strategic partners who are participating in policy designs, who are at the table when decisions are being made, who are engaging in even social contracting mechanisms that are happening right now in governments, who are also strengthening the systems, even for accountability with our government. We also need to also look at how we shift in terms of, strengthening the health system. And of course, there's a lot we have learned, and we know we have had the faith-based health system, and we are contributing quite a bit. But how does the evidence coming from the faith-based health system, shape programs, shape policy? And we need to have that shift so that our visibility and our input, comes even stronger, because we have the data and we have the evidence that we are generating. And maybe the last thing, I just want also to echo what Gracia has said, the need, to really bring our presence in terms of global advocacy. And there's a lot we are learning from, the local presence, but can we now bring that at a global, platform, and really see how we engage in, global health equity debates, how we ensure that we are, bringing in innovation that we have learned over time, and really engaging in that space. And there are so many opportunities that are available. We need to ensure that we are leveraging in these opportunities, and we don't have to wait to be invited. I mean, we push ourselves to be there. The little resources that, are within the faith communities, how do we utilize those resources and take advantage so that we are bridging the community trust gap with whatever is happening at the global level, even as we engage in that.
Thank you very much, Jane. I totally agree. We can't afford to wait to be invited. I think the church's voice, and that's what we as member churches from WCC and partners have seen over the years, is the important role that the faith community's voice is at these meetings. We speak a kind of a dual language, a language of prophetic calling, to stand up for the most marginalized and the poor, but at the same time speaking to power to be able to do what is right, and the human rights voice bring that. So I think we cannot wait to be invited. We have to stand together. And I think that part of finding our partners also more and more in standing together, that is an ongoing importance. Zeal, you have your hand up for a while, and then we go to Amir.
Okay, thank you. Good afternoon, everyone, depending on your location. So my main concern here is, most times we think that whenever we reach out to faith-based leaders, that they will in turn reach the congregation and the other members of their fold. But most times we find out that they just come, they learn, they hear, they go back, and nothing is being done. And yet people in their fold, people under their watch, are suffering through these health challenges, and nothing is being done. I can remember one of the WCC conference I was privileged to attend back in 2023 here in Nigeria at Abuja. So my intention was, when we returned, I was a seminary student then. My intention was, when we returned, the school will give us the opportunity to speak on what we learned, ask us questions. What did you gain? Okay, come and share with your fellow seminarians. Let us know how to work with these challenges or these health issues. But nothing was done. I made some moves to see how they will bring up the topic so that we can share. But we weren't given the privilege. This 2026, 3 years on, and nothing is being done. So what I could do was speak to my friends that I could speak with, but the challenge still remains. You will find out that maybe because I am in the grassroots, I know this. I can bet you that there are so many members of our Christian faith that are challenged with these health issues, and yet they have not heard anything about it. Even when some pastors, ministers hear that a member is HIV victim, they begin to shrink away from such members. And one particular thing I learned from that conference was, we don't need to stigmatize those with these challenges, because healing begins with us accepting them for who they are. Thank you.
Thank you so much. Sheikh Amir, good to hear your voice. Sheikh Amir, I see your hands up. Can you unmute? Okay. Seems like Amir is having trouble on that side. Thank you for this rich discussion. I just want to read what Allan has written here. He mentioned the ongoing campaign that we were having about advocating for access and engagement with lobby makers and parliamentarians and young people around long-acting injectables, and also the integration discussions with the Permanent Secretary of Health, which is real good to get us to those tables. Yeah, and the important role of that young people has played in this. I'm going to underline that. That is so important to have your voices, guys. Thank you for doing that and being involved. We are guys with gray hair. We want to make space for you as young people to really bring your voices. I just want to check if Sheikh, if you still can unmute. I don't see anything. Otherwise, I'm going to ask Jonah if you want to take us towards your thinking about next steps or what lies in the future, having listened to all.
Thank you very much, Christo. Just confirming whether I'm heard. Hello, Christo.
Yep, we hear you fine.
Oh, thank you very much. First of all, I'd like to thank the steering team. Thank you, Manoj and Gracia, for giving the young people an opportunity to really be part of this amazing forum, and not only to be there, but also to participate. I think that is something that is very, very wonderful. Having young people and learning from you and working along with you, getting the knowledge and see how things are done, and also giving an opportunity to participate. It is something very, very wonderful. I really want to appreciate you. At least you, when you say we want to work with the young people, you're actually doing it in action. Most of the religious leaders I've worked with and most of the big people I've worked with, they say it, but they don't practice it. Well, here it is said and it is practiced, and that is something that I really appreciate. Well, on the next step, as WCC, the dissemination of the manuals, I believe, will continue, and Gracia talked about that we have 4 new manuals that will be distributed, and also working with young people that I've talked about, and alongside the communities. And it's something that we are really looking at as one that will enable us to have a sustainable response to HIV and the pandemics. And I really want to say that, yeah, let's keep on. Sometimes the work is tiring, but I believe that our work and our labor is not in vain. Indeed, we are seeing some of these results, and so we should keep on and keep on and keep on until we realize victory someday. Thank you very much, Christo.
My mute button disappeared. Thank you very much, Jonah. And I want to thank every one of you who joined us for this call. I hope you are also invigorated by the new possibilities in the face of challenges. I see, Allan, you have your hand up. I'm going to give you a last word before we go on.
Yes, Christo. I wanted to say something, and biggest lesson we learned last year, and I was just looking at the topic today, was challenges to change, challenges to change, and between from challenges to change is resilience. And I would want to finish by saying that change does not begin when circumstances improve. They begin when things are no longer comfortable, you know, and it's courage is what took us through everything last year, and the challenges that we faced last year are not just barriers their invitations, their invitations to grow, their invitations to lead, their invitations to become the generation, to become the people that refuse to normalize silence, to normalize justice, to normalize that heaviness in the heart where people are asking themselves what's going to happen next. That silence, that there are invitations to not normalize stagnation. And if we are going to change, if we're going to go through 2026, possibly, or if we're going to go through 2026, I believe the best thing is just to remain just as consistent as we were last year, maybe even better, more courageous, more collective, and through it all, we just consistently learn as a young person. So that's how we take it here. Just we'll stick consistently. We still be consistent. We still be courageous, and we'll still be holding hands together and working through it all together. So that's what I'll finish off with before I go.
Thank you very much, Allan. I see Sheikh Amir says he's having difficulty to unmute. We are thankful you joined us, Sheikh, and we wish you Ramadan Mubarak to you and your family in this time. Let's close this in prayer. And now may the Lord torment you. May the Lord keep before you the faces of the hungry, the lonely, the rejected, and the despised. May the Lord afflict you with pain for the hurt, the wounded, the oppressed, the abused, and the victims of violence. May God grace you with a burning thirst for justice and righteousness. May the Lord give you courage and strength and compassion to make ours a better world, and to make your community a better community, and to make your church a better church. And may you do your best to make it so. And after you have done your best, may the Lord grant you peace. Amen. Thank you, everyone. Have a good afternoon and day wherever you are.
Thank you.